Welcome you all to one of the most anticipated sessions of the 8th World Conference on Public Health Special Forum comparing the effectiveness of public health systems in helping countries contain the COVID-19 pandemic. We can see most of our participants are watching us from the lobby, so we would like to request you all to come inside the session by clicking the join button to be more engaged. So before we move into the session, please let me briefly introduce the session moderator, our conference co-chair, Professor Hemantram Yadav. Professor Dr. Hemantram Yadav is former professor of Community Medicine Department in Masam, Kuala Lumpur, Malaysia. Prior to this appointment, he was head of community medicine in International Medical University and also head of family health division in the Department of Social and Preventive Medicine in University of Malaya and the head of family health and development division in the Ministry of Health, Malaysia. He received basically his medical degree from Ministry of Kerala, India, and went on to do his master's in public health in University of Malaya and MBA from Boston University. He has over 40 years of experience in the field of public health, both locally and internationally. He worked as a consultant for WHO, UNICEF, and developed Sweden many in countries in the Western Pacific region, areas such as primary health care, maternal and child health care, and health services management in several countries. While in the Ministry of Health, he conducted several workshops in the area of health and hospital management, both locally and in the Western Pacific region. He has published more than 90 papers, authored several books, and has presented technical papers in both local and international level. During his career in Ministry of Health, he served as chairman of the Reproductive Health meeting organized by the Family Health Division of World Health Organization, HQ, in Geneva, and also as vice chairman of the members of interested parties meeting in WHO headquarters. He is a fellow of the Academy of Medicine Malaysia, Public Health Chapter, and is on editorial boards of several journals. For his work, he has received several awards locally and internationally as well. He is a recipient of the prestigious Hind Ratnan Award from the NRI Welfare Society of India, New Delhi, for his work in the area of public health. That was just a glimpse of what he has done and achieved. So without further ado, I wish to cordially invite Professor Yadav to moderate the session. Professor Yadav, over to you.
Thank you, Aisha, for those questions. Let me welcome you. I was here in the morning to welcome you, and fortunately, from late night. But I hope you will enjoy this forum. Forum is comparing effective health system, helping countries contain the COVID-19 pandemic. Now, it's a very important forum, and we have with us professors who will be able to visit this forum. Unfortunately, two of them are not made on a tape. Unforeseen circumstances. Prof. Moy she has sent a tape. I will get it later. But meanwhile, she is a professor from the Department of University. She is a research interest is translational research. Several papers. Now, unfortunately, tonight, but she sent a tape, and I hope that I will be. I will play that. Dr. from the from Toronto. Also, plan analysis and social research and information from Toronto, Canada. He as well. So we have one strong candidate, and with us we have Professor Chu Wati, who is DSE and DSWL, and he's the director of Professor Global Application PhD from the Health Management and Policy Program, Public Health and Human Resources from the Oregon State University in the U.S. This is universal health care systems, equity, and he's also fellow to several universities in Taiwan. Now, it's got a lot of I'm going to call upon Dr. Chun Hui to speak a word on the caring health system in helping countries with the COVID-19 pandemic. As you know, the COVID-19 has been going on the last 2 years. The different countries have been approaching the effectiveness of the prevention of the program in different ways. And Professor Chu will try to take us through some of the systems with his so this brief introduction of Chun Hui to take some. Thank you.
Thank you very much, Dr. Yadav. It is a great pleasure for me to share with you briefly about the significance of health system in controlling and preventing the pandemic. So I'm going to share my screen. So this is a topic I'm sharing with you briefly. The topic is health system strengthening and the COVID-19 pandemic. And I have 4 brief sections. The first one briefly talk about the current situation of the pandemic, the COVID-19. And then the second section, I will briefly talk about overview of the variation of national approaches and outcomes. And the third part will be my main focus on health system strengthening and how does that relate to the pandemic. And lastly, how do we move toward a resilient society and health system? So let's briefly look at where we are in terms of this pandemic. And I constructed and just updated yesterday about the key timeline. And I divided that into 3 phases. The key division is the vaccine. So the phase 1 is pre-vaccine until the end of 2020. And that marked the beginning of phase 2 when we begin to have vaccine. And currently, we are moving toward the phase 3. I call it the transitional. And because of the time limit, I'm not going to discuss all the detail. I firmly believe that had the World Health Organization has its due diligent duty, we would not be in this pandemic at all, because Taiwan was the first country reported to the International Health Regulation on December 31st, 2019. And that wasn't taken seriously. Had WHO taken seriously, we would not be in this pandemic. And so far, we have learned this will be critical to healthcare system. This is a comparison with the list of countries in terms of age-specific fatality. And obviously, as people get older, on average, the case fatality rate are much higher. And in this phase 3 transitional period, this will be a focus, how well the healthcare system can respond to this high-risk age group. And this is where we are today. And I selected a few countries to highlight different, including every continent. And India and Kenya had their peak daily confirmed cases quite different from the rest of the group. They had their peak both in May last year, whereas most of the example country I selected had their peak this year. And this is largely due to the new variant Omicron. And this is the deaths per million. Again, I selected countries from different continents to compare. Chile and Canada had their peak in the first year. And then Germany, US, India, and Kenya had their peak last year. And then New Zealand and Taiwan have their peak this year. And this is comparison across different income groups. In the first year, you can see the high income group suffered the most on the case fatality rate. But by last year, around this time, the case fatality rate dramatically reduced, and they continue to reduce as of today. So the next section, I will briefly look into the variation. So again, I select a few example countries to show how, at the beginning, each country, how fast and how effective they respond to this pandemic, resulted in very different fatality and cases, particularly during the first 1.5 years prior to the availability of vaccine. And this is the containment health index. This is the latest. Again, I selected countries from different continents, and this is where India is. India is right now is a much more relaxed condition. And with different response, we see the different excess mortality. The black line is the 5-year average prior to the pandemic, and then the orange line and the purple line represent during the pandemic. And of course, US, UK suffer a major excess mortality during the first 1.5 years of the pandemic, whereas Norway, South Korea, and New Zealand, they didn't have significant higher or excess mortality. Cumulatively, Europe contribute the most of the deaths, even though Europe is not the most populated continent. I summarize some of the barriers to controlling the pandemic. And the number one, we need to pay special attention in adequate governance, leadership, and the public's trust of government, because this factor dictate whether and to what extent a healthcare system will respond. So merely having a strong healthcare system is not enough, as this pandemic has shown us, because there's an exterior force, particularly the political power leadership, that dictate whether and to what extent the healthcare system respond. And the second factor is individual freedom over social freedom and social trust. And the lack of that present a fertile ground for disinformation and misinformation. And then in some society, there's preference of anti-intellectual and anti-science. They don't believe any scientific evidence. For example, in the US, to this day, more than 2.5 years passed, more than 1 million Americans died. There are still at least 10% American, they don't believe there's such thing as pandemic. And of course, those people will not take any action. And the last one is the direct factor that we are focused today, the inadequate public health system and infrastructure. So now let's look at the health system trending and how does that relate to the pandemic. So I'd like to show this, the latest comparison based on confirmed case per million versus GDP per capita. And you can see there's a relationship, semi-linear relationship. Ironically, the GDP, when the country with the higher GDP that across different continents, they tend to have more confirmed cases. And that shows money or income may not be the key factor in determining how well a country responds to the pandemic. And that can also translate to resources for health systems. So the health system is a social institution, and it's a systematic structure of a society that directly serves to maintain and promote health of its population. And a health system includes very broadly what we sometimes refer to as a public health system, that ranging from governance, organization structures, all the way to financial management and daily activities. And WHO also, in its advocate for strengthening healthcare system, introduced the 6 building blocks. I will not discuss the detail. You can easily find those in the literature and WHO website. So the role of a national health system in the pandemic control, with the precondition an effective governance and leadership, the national leadership, because as I mentioned, that's dictate whether the health system respond or not. And given that a country with an effective leadership and governance, the health system's role is provide the infrastructures, mobilization and integration of the resources to combat the pandemic, and also very importantly, assurance of equitable access to all the measures, and including vaccines. Likewise, the health information technology and pandemic control play a very important role. But there's something beyond the traditional health system boundary. The number 5, social institution, that health system can strengthen the solidarity, social well-being, and public trust. So this is a non-healthcare function. Similarly, health system also played an important role during the pandemic in coordination with other sectors. And as I mentioned, there are forces beyond national health system that, as we look empirically the result, it dictates the outcome of the response. The governance and leadership, the solidarity of the society, the infrastructure beyond the healthcare system. What we need, the infrastructure, is not just within the healthcare system, the health system, but also the infrastructure and the so-called social capitals. And of course, the national resources. But national resources is not the deciding factor, as earlier the slide shows. It's kind of reverse situation. The more wealthy country, they suffer more. But there's also other competing priorities. And we should always keep in mind, even during a pandemic, there's a delicate balance we need to pay attention to. That is protecting lives versus protecting livelihood. They are not necessarily in contradictory with each other, but sometimes they're competing with each other. So how do we move towards the end of this pandemic and toward a resilient society and health system? So this is where we are today. And compared with first year, the daily case, the daily death, and then the second year, earlier this year, I'm sorry. Earlier this year, we were at the 4 million per day and 10,000 per day deaths. And this is where we are now. And similarly, the daily confirmed deaths per million people, the top curve are the high income. The middle curve is the world, and the green one is the low income. So the low income country, despite there might be under testing, under reporting, but still their cumulative deaths are much lower than the rest of the group. And this is yet another indications that resources may not be a key factor in combating the pandemic. And to strengthen a resilient society and health system, we have to resort to one of the older idea that WHO introduced in 1974 and the World Health Assembly in 1978 unanimously adopted the primary health care. And I highlighted its principles: practical, scientifically sound, socially acceptable, universally accessible and acceptable, and affordable, and based on the two important spirits, self-reliance and self-determination. And recently, WHO updated the primary health care approach, including the Declaration of Astana in 2018. And the three main approach, including meeting people's health needs throughout their lives and addressing the broader determinant of health that is beyond the traditional healthcare boundary, and then empowering individuals, families, and community to take charge of their own. And I also summarized some of the key barriers to prevention and control of pandemic, not just this one, but also for the future one. The poor global health governance. And if we compare the COVID-19 present day versus 2003 SARS, the WHO in 2003 SARS was much more competent in preventing a major disaster, major pandemic. And then the pandemic and vaccine nationalism is another barrier to better control. And inequity in public health infrastructure and resources, even though this may not be a deciding factor, but still it can present, particularly in the phase 2, the post-vaccine era. And then the fourth factor is the nation state's will and capability to control the pandemic. And this often dictates whether and to what intensity a health system responds. And the last one is timely vaccination against emerging new variants. And in the second phase, the post-vaccine era, this is the example of how the upper income, high income, middle income, low income, they have unequal access to vaccination. And this pandemic has generated multidimensional crises. But don't forget, there are also collateral damage that need the coherent and comprehensive response beyond health system. So it has widening intranational and international inequality. And then the alternative effects, misinformation, cause social instability. And the initial knee-jerk response for nation state is survival mode. And then the long-term physical distance cause harm to mental health and human relationship. And the damage to our education system is just one of the many collateral damage that this pandemic has caused. So we need to strengthen the capacity building for a resilient health system, that including improvement of governance, including leadership, strengthen our personnel, resources, infrastructure, also collaboration in research and development, including monitoring the emerging communicable diseases. And technology and information system also plays a vital role, especially combating the mis and disinformation. And lastly, we need a resilient society beyond a resilient health system. And one of them is to make our society more resilient is a social vaccine. And the social vaccine include 4 key components: a life with security, opportunities that are fair, and a planet that is habitable and supports biodiversity, and governance that is trust. So as we can recognize, the social vaccine that is vital to our resilient society goes beyond the traditional boundary of our health system. And finally, I'd like to share this quote on social determination of health by Salvador Allende. He said, "It is impossible to give health and knowledge to people who are malnourished, who wear rags, and who work at the level of unmerciful exploitation." And this is a classic concept and framework of social determination of health. And thank you very much for your attention. That concludes my short presentation.
Thank you, Prof. Suhashi. Very interesting. If I open up for questions, I just wanted to ask you a very short question. One is, how active has been the vaccination program, although very crucial in the control of this pandemic? Vaccination program effectiveness in the pandemic. I hope did you manage to get the question?
Sorry, I hear an echo from the audio. I couldn't hear clearly of the question.
My fault.
Professor,
Okay.
Professor
I'm
Adu,
to-
is there any possibility to talk without the mic?
How effective has been the vaccination in the pandemic control?
Okay, now I hear it. Yes. The vaccine has been effective up till the current stage, Omicron. And in terms of prevention of infection. But now we learn there's a limitation of the available vaccine that's applied to all vaccine. This pandemic has taught us a lot of lessons because this is a new disease, new virus, and almost every week we learn something new. So the latest evidence that we have now is most of the available vaccine are still highly effective in preventing severe symptoms or death. However, those vaccines were developed based on the original Wuhan strain of the virus. And since late last year, we are encountering a very different mutation strain, the Omicron and its subvariant. And the Omicron its subvariant is very different from the original or the previous variants, such as Alpha and Delta. To the extent it makes the all available vaccine far less effective in preventing infection, but they are still very effective in preventing severe symptom or death. And now several vaccine developers, they are rushing to develop a new vaccine that can prevent infection from both the original strain and Delta strain, as well as the Omicron and its subvariants. The other information we learned is vaccine, all the available vaccine, their protective effect unfortunately are not long lasting. Various studies showed the protection effect started to decline, can be as early as 2 months after the vaccination. And of course, as the time passed, that protection effect continued to decline. And the protection effect declined sharply, particularly the protection against infection, but much slowly in terms of protection against severe symptom or death. You are muted.
You also mentioned that mere having strong healthcare system is not enough. That's interesting because normally you would think that a healthcare system is very important, but use it, it's just not mere enough. Does that mean we need anything else more than just the healthcare system?
Yes, what I meant, I'm not trying to downplay the significance of health system. And again, by health system, as you have seen in my presentation, It's very broadly defined, including all public health systems. And let me put it this way, a highly effective health system is a necessary condition for fighting the pandemic prevention and control, but not a sufficient condition. As some of my slides shows, in terms of fatality, in terms of cases, the empirical evidence shows that on average, the higher income suffer more. And the higher income country, including US and European countries, they have far more resources and far better infrastructure of health systems, yet they suffer more than the middle income and low income country in terms of cases, especially in terms of death. And that shows one of the important points I keep trying to reiterate and emphasize. The national government's governance and leadership is a critical point. So for example, in the US, during the first 4 to 6 months, US has reached resources, yet its leadership in 2020 continued to claim this whole, especially in the first few months, this whole pandemic is a hoax, it's a fake news, and they don't take any action. And several European countries, their leadership was slow to respond, to mobilize their health system. And so if you don't have a leadership, because when facing with the pandemic, what required is more than just health system. It requires the social mobilization. Because for example, if the government is going to issue quarantine, that often goes beyond the authority of health system. If the government is going to close the border to lock down again, that's beyond the authority and power of health system. And or mandate mask, mandate vaccine. These are all goes beyond the authority, traditional authority of health system. So it's dependent on the national leadership and governance to decide to what extent they want to take action. And Taiwan did the best during the first 1.5 years because Taiwan was the first country to respond, to mobilize as early as January 2nd of 2020. And that's an example. And Singapore and Vietnam, Thailand also did very well because those countries, they suffer from 2003 SARS. So they are highly alerted to anything suspicious, and they mobilized and they took action very swiftly. Despite, for example, Vietnam doesn't have a very well resources or infrastructure, still Vietnam responded very well.
Thank you, Prof. Chu Hui. Any questions from the floor? Anybody would like to ask any question before I let Prof. Chu Hui to go? Nobody seems to be, everybody must be tired, Prof. Chu Hui. So with that, I'd like to thank you very much for the excellent presentation, and hope to see you again in the near future. Thank you so much, Prof. Chu Hui.
Thank you very much, Dr. Gadef. It is a great pleasure.
Now, going on to the next session, unfortunately, Prof. Moy is not able to make it, but she has sent us a tape. And if I can request Mahisha to play the tape. We will not questions, but can Mahisha play the tape of Prof. Moy?
Hi, good evening. I am Professor Dr. Moy Fong Ming, a Professor of Epidemiology and Public Health from the Department of Social and Preventive Medicine, Faculty of Medicine. First, I would like to thank the organizing committee for inviting me to join this forum in presenting the effectiveness of public health measures in helping to contain the COVID-19 pandemic. I will be speaking about the Malaysian experience, and I will try to summarize all that in 10 minutes. Now let me share my screen. Right. Okay. On 30th January 2020, COVID was declared as a public health emergency of international concern by the WHO. And Malaysia has detected the first COVID case on 5th February 2020. And on 11 March 2020, COVID-19 was declared as a pandemic by the WHO. As of 26 July 2022, Malaysia has 4.65 million confirmed cases and 35,923 deaths. We can see that there are a few peaks, and the peak in March, starting from March to maybe September, October 2021, was due to the Delta variant, and there is a high death rates, the high number of deaths. For the peak in 2022, there was a lower death, probably due to our country vaccination rate was high. Our country started vaccination for COVID sometime in April, May 2021. If we compare with country like US, we are actually not too bad. This is the daily new confirmed COVID cases per million people. And these are the daily confirmed COVID-19 deaths. Okay. So the management of COVID-19 in Malaysia was divided into two arms, mostly the public health arm and the medical arm. So I will only concentrate on the public health arm, where early disease detection, contact tracing, and quarantines was implemented. Movement control order, where there is a nationwide lockdown, which was a measure that affect the country as well as the people drastically. There's also risk stratification strategies. All the adherence is compulsory under the Control and Prevention of Infectious Disease Act 1988. In addition to vaccination, which was available in April, May 2021, 1 year after the pandemic was declared. And there's also non-pharmaceutical interventions for the community, where the people were advised on what to do, like physical distancing, maintaining hand hygiene, respiratory ethics, wearing face masks, stay home if symptomatic, etc. And they also required to scan for body temperature when they enter any premises or shops. And there's a checking in with My Sejahtera app. There's an app at all public places. So My Sejahtera app is one that is used to check in when they're visiting new place, and it's also used for COVID-19 vaccine registration. Users are able to get treatment if they're diagnosed with COVID and locate nearest health facilities for COVID-19 screening. There is also an extension of this app, which is the My SJ Trace, where it's using Bluetooth to scan for other users and alert them if they had contact with a COVID patient. And this is how it looked when they use the My Sejahtera app to clock in, check in, and temperature check. But all this was stopped in April 2022 or January 2022. So this just shows that the implementation of movement control, the movement control started in March, and there are different phases. Movement control MCO, conditional movement control CMCO, recovery movement control, MCO by states, and total lockdown, and national recovery plan, And currently we are in the transition to endemic phase. So the purpose of MCO is to flatten the curve of infection, and there's a prohibition of movement and mass assembly, included religious, business, education, sports, culture, and social activities, except supermarkets, grocery stores, and places for basic necessities. So this chart shows the measures allowed at different phases of the movement control. In the current state of transition into endemic, there are more relaxation. Face mask is still required, but business are all can operate as per license, and they are allowed to open past midnight. They're still required to check in using MySejahtera. Large gatherings where 50% capacity is done away. That is implemented on the 1st April. On 1st May, there are more relaxation. MySejahtera was no longer needed, and face mask is only mandatory indoor and public transport and e-hailing rides. Outdoor is optional. Physical distancing is no more required, but is encouraged. And quarantines of patients are shortened if they are tested negative on day 4. This is just to show, I would like to show the COVID-19 immunization program, where the healthcare workers and frontliners were prioritized. And then in April to May, high-risk groups and adults aged 18 were allowed for vaccination and so on. And then the adolescents and children aged 5 to 11 also open. So as of 27 July, the adults population with 3 doses is 68.6%, elderly is 70.8%, and adolescents, they were only allowed 2 doses, so it's 92%, which is very good. Children 5 to 11 years is a bit low, which is less than 50%. So with this high vaccination rate, in addition, during this transition to endemic, the community are encouraged to do tests, doing a self-test, using self-test, and to report if positive or negative, and isolate and inform and seek treatment if positive. So this is more of a self-empowerment. And if we look at the chart again, so vaccination started sometime April, May 2020, and during the Delta wave, there are high number of deaths, but after the nation or the country had high vaccination rate, during the Omicron wave in 2022, the death is much lower compared to the Delta wave. And currently, it looks like we may proceed to another peak, but the death is very low because our vaccination rate is very high, as presented just now. So what have we learned? So we learned that COVID-19 is a whole of society issue. It has direct health impact on hospitalization and death, indirect effects of health such as delayed routine and preventive care, overstress of the healthcare systems, increased mental health burden, and children suffered significantly during the prolonged school closures, especially among those low-income countries. And there's economic harm and dislocation, which decrease the quality of life of our people. So trust is very delicate, but it's very critical for an effective pandemic response. There must be public trust in government and in shared social responsibility among the citizens. This also applies to companies where the policy for return to in-person work. Agility and speed will be the new basis, as emerging evidence on topics like benefits of masking, reinfection, risk of new variants, difficulty of achieving and herd immunity, and the benefits of booster all require policy and behavioral changes. So the country's business and stakeholders have to balance the benefits of incorporating new evidence into their response plan against the confusion and frustration that frequent changes can cause. So the government policy is important. The individual behavior is also very important because we know that lockdown, mask mandate, and vaccines are effective, but their effectiveness varied depending on how seriously the people took the rules and the way they behave. Empowerment of individuals are important, and work will never be the same. So thank you. That's the end of my presentation.
Thank you. Unfortunately, this was the recording, so I will not be able to take questions. However, in summary, I'd just like to thank both the speakers from the University for an excellent presentation. Now, in conclusion, as we know, that when you compare the effectiveness of the public health systems in helping countries contain the COVID-19 pandemic, it varies from country to country. It is not just the health systems alone that can manage the control of the pandemic, but there are several other factors such as resources, materials, human resources, beds, hospitals, etc. But more importantly, the human element as well. The belief that the preventive mechanism is working. Prof. Chu just now said that in the United States, the people still don't believe the epidemic is actually an epidemic. It's considered fake, and many of them don't take precautions, etc. Although they are pointing at us. So it's a very complicated issue regarding the control of this pandemic and effectiveness of the public health systems in countries from different countries. So with that, I like to conclude. I'd like to thank again the two speakers for an excellent presentation. Thank you so much, Maisa, and good night.
Thank you so much, Professor Adu, Professor Chu, and Professor Moy. Thank you so much for the wonderful forum and for sharing your knowledge with our participants. And we believe that you all have gained new knowledge and a lot of valuable insights through this forum.